Vocabulary Quiz 19. Hypothalamic amenorrhea. These vocabulary quizzes are based on topics from official OET tests. There are 20 questions with ABCD answers. It's crucial to expand your vocabulary to succeed in the OET test. Learn the words, learn the spelling, pass the test. Good luck. Hypothalamic amenorrhea is a condition where menstruation stops due to a problem in the hypothalamus, a part of the brain that regulates the menstrual cycle. This can be caused by factors such as excessive stress, extreme weight loss, or excessive exercise. The hypothalamus is a small region of the brain that controls various vital functions, including body temperature, hunger, thirst, and the release of hormones. What is a common hormonal change in hypothalamic amenorrhea? Increased estrogen, elevated prolactin, reduced luteinizing hormone, normal follicle stimulating hormone. The correct answer is reduced luteinizing hormone, a hormone that triggers ovulation. Which of the following is a key cause of hypothalamic amenorrhea? Polycystic ovary syndrome, excessive exercise, uterine fibroids, hormone replacement therapy. The correct answer is excessive exercise. What is typically low in patients with hypothalamic amenorrhea? Cortisol, progesterone, testosterone, or insulin? The correct answer is progesterone, a hormone that prepares the uterus for pregnancy. Which type of amenorrhea does hypothalamic amenorrhea fall under? Primary, refractory, functional, genetic? The correct answer is functional, related to how the body works rather than structure. What system in the brain controls reproductive hormones and is affected in hypothalamic amenorrhea? Medulla, hippocampus, hypothalamus, pituitary gland. The correct answer is the hypothalamus, a brain area that regulates hormones. Which lab finding is most likely in someone with hypothalamic amenorrhea? High estradiol, elevated TSH, low gonadotropins, increased androgens. The correct answer is low gonadotropins. Gonadotropins are hormones that stimulate the ovaries. Which of these is a psychological factor contributing to hypothalamic amenorrhea? Memory loss, anxiety, hallucinations, or insomnia only? The correct answer is anxiety. Which treatment is most appropriate for restoring menstruation in hypothalamic amenorrhea? Chemotherapy, increased caloric intake, diuretic therapy, thyroid hormone replacement? The correct answer is increased caloric intake, the number of calories eaten. What is the most appropriate test to rule out pregnancy in amenorrhea? ultrasound, progesterone challenge, serum HCG, or pap smear? The correct answer is serum HCG, a blood test for pregnancy hormone. What role does leptin play in hypothalamic amenorrhea? It increases appetite, it regulates estrogen receptors, it signals energy sufficiency to the brain, it lowers insulin levels. The correct answer is C. It signals energy sufficiency to the brain. What is energy sufficiency to the brain? It means having an adequate and continuous supply of energy, mainly from glucose, to support the brain's normal functions, such as thinking, memory, focus, and overall mental performance. Which symptom is most commonly associated with hypothalamic amenorrhea? Hirsutism, galactorrhea, hot flashes, missed periods. The correct answer is missed periods, skipping menstrual cycles. In which population is hypothalamic amenorrhea most common? Pregnant women, adolescent athletes, elderly men, postmenopausal women. The correct answer is adolescent athletes. What hormone from the hypothalamus initiates the menstrual cycle? CRH, TSH, GnRH, ACTH. The correct answer is GnRH, gonadotropin releasing hormone. Which eating disorder is most strongly associated with hypothalamic amenorrhea? Bulimia nervosa, pica, anorexia nervosa, orthorexia. The correct answer is anorexia nervosa, eating disorder with extreme food restriction. Which of the following is not a consequence of untreated hypothalamic amenorrhea? Osteoporosis, infertility, hypoglycemia, endometrial cancer. The correct answer is endometrial cancer. What is often the first sign that a woman has hypothalamic amenorrhea? Weight gain, acne, missed menstrual cycles, breast tenderness. The correct answer is missed menstrual cycles. Which neurotransmitter is linked to stress-related hypothalamic dysfunction? Acetylcholine, serotonin, dopamine, GABA. The correct answer is serotonin, a brain chemical linked to mood. What kind of bone scan might be recommended in long-term hypothalamic amenorrhea? PET scan, MRI, DEXA scan, CT scan. The correct answer for a bone scan is DEXA scan, Dual energy X-ray absorptiometry is a medical imaging test that measures bone mineral density. It helps diagnose osteoporosis and assess fracture risk by comparing bone strength to normal reference values. Which of the following would most likely stimulate GnRH production again? Intense cardio, continued fasting, stress management, caffeine intake. The correct answer is stress management. Finally, what is the recommended long-term focus for recovery from hypothalamic amenorrhea? Hormone injections, weight loss, lifestyle change, or oral antibiotics? The correct answer is lifestyle change. That's the end of the video. I hope you all learned a lot of useful new vocabulary. Please like the video to help me build this channel for you. Thank you for watching. Good luck with your studies. Stay motivated. You can do it.